Martina, are we on the webinar?
Yes, we are.
The broadcast is now starting. All attendees are in listen-only mode.
All right, good afternoon, everybody. Welcome to the Maricopa County News Conference for April 23rd from the Unified Command. My name is Fields Mosley. I'm the Communications Director and the lead PIO for the Unified Command and the Joint Information Center. So we'd like to thank you for being here today for this news conference. Thank you to our friends from the news media for joining us and asking great questions today. Also, thank you to members of the public who might be joining us via YouTube or through Facebook. So today's topic is about three critical parts needed to surveil and control the disease in our county moving forward. We're talking about contact tracing, we're talking about testing, and personal protective equipment. We also recognize that a number of you might have questions about the latest data that was released earlier this morning. Sadly, the latest report pushed our number of deaths in Maricopa County above 100, and we certainly feel for the families and friends of those that we've lost. Dr. Rebecca Sonnenschein, Medical Director for Maricopa County Public Health, is going to speak first today, followed by Robert Rowley, who is our Director of Emergency Management here in Maricopa County. He is going to talk about personal protective equipment, how much has been distributed, and how much has been ordered, and we are all aware of the shortcomings in the supply chain right now. So members of the media, the same instructions I've been giving for the last couple of weeks. We're going to be calling upon you by our moderator, who is a part of the webinar, and that is when he will unmute your microphone. If you have your hand raised virtually in the webinar, please make sure your microphone is unmuted on your phone or your computer so you can ask your question. Please ask one question at that time. We've been able to get back to second questions every time we've done this, so we will certainly do that once again. So if you're having difficulty raising your hand or unmuting your microphone inside the webinar, sometimes that's just a glitch in the program because of the extreme use in the GoToWebinar software. We cannot fix that on our end. You might have to log out of the webinar and log back into the webinar if you're having those kinds of technical difficulties. We'll certainly give you a chance to ask your question once you rejoin. You can also join us through the phone number provided in the instructions as well, if that works for you. For the first time today, Joanna Molina from Public Health is going to be joining us as well. So when we get to the Q&A portion of this press conference, she will come up and she'll also answer the question. Once it's stated in English, she will answer that question in Spanish. And if any of our Spanish language stations or reporters need some follow-up to this, we'll be happy to take those after the press conference as well. But we'll do our best to get to most of the answers in Spanish today as well. So with that, I would like to introduce you to Dr. Rebecca Sonnenschein. She is the Medical Director for Maricopa County Public Health.
Good afternoon. Oh, it's Rebecca, R-E-B-E-C-C-A, last name S-U-N-E-N-S-H-I-N-E. So I want to talk to everyone about contact tracing. It's been getting a lot of attention in the media, and I want to tell you how public health uses contact tracing really on just a daily basis. So contact tracing has been a fundamental public health practice for over a century, and it's an important tool in interrupting the spread of infectious diseases. I think most people are most familiar with contact tracing in the setting of sexually transmitted diseases or tuberculosis or even measles, but we use it for almost every reportable infectious disease that is here in Arizona when the disease spreads from person to person. So how does it work? When someone gets tested for COVID-19, the specimen is collected by the provider and sent to a laboratory. It takes up to 3 days for that specimen to actually get to the laboratory, depending on where that laboratory is. So the lab then runs the test and sends that result electronically back to the Arizona Department of Health Services through electronic laboratory reporting. Once ADHS receives that test result, it gets automatically loaded into a system called MedSys, which is our electronic disease reporting system. And that state reporting system feeds automatically to the county, where the infectious disease investigators and nurse epidemiologists can download that information from the reporting system. And that's where the Maricopa County investigator first learns about a positive case of COVID-19. So the investigator will review that result, pull the information from the system, and then start the case investigation. So the way it starts is the investigator contacts the case and does an extensive interview. They ask the case about all of the people in their household, because we know that people in the household are at the highest risk of being exposed and infected with COVID-19. They also ask about healthcare workers who saw the patient while they were infectious and who treated them, because we know they're also at higher risk, particularly if there were any issues with personal protective equipment. And they also find out who else was in the facility during the time that the case was there while they were infectious. Finally, they ask about community contacts based on how much time they spent with the person while infected. So the investigator is trying to discover who of the contacts could be at risk for exposure. And that means that they spend at least 10 minutes within 6 feet of the person, starting at the time period 48 hours before the infected person ever developed symptoms. And that's what we've learned during this process, is that people are infectious before they develop symptoms, and that's why we go back those 2 days. And the investigator literally walks through every single day, starting those 2 days before symptoms began, and walks through every activity, every meal, and finds out who the person was involved in, how long they interacted with that person, what type of interaction it was, to make a determination about whether that individual would be considered exposed. As you can imagine, this interview can take anywhere from 1 to 3 hours, depending on what language the person speaks, how sick a person is, how long that time period is that the person was infectious and out in the community, and how many people they had contact with. So during this time, investigators are part public health, part detective, and part social worker, trying to establish rapport with this person that they've never met and trust, and at the same time trying to cover as much information as possible without judgment. They also have to interpret the information as they're hearing it from a technical standpoint, so that they can ask appropriate follow-up questions and get the full picture of who was exposed, how they were exposed, and what level of risk there is. And this is especially true when investigators have to ask questions that might be personal to the case, such as, did you go to work while you were ill? It's important that they get truthful answers and that people know that they are not being judged and that this information is being used purely for public health. So during the interview, the investigators are taking note of all of the locations of all the people who could have been exposed while the person was infectious. And they ask the case to provide contact information for the people mentioned during the interview who are at risk for exposure, including household contacts, healthcare workers, and anyone who may have treated them. Contacts who the investigator considers to be at risk for exposure to COVID-19 are then called by that same interviewer and given information on what symptoms to look for, told that they were exposed recently by someone who was infected with COVID-19, and what they need to do if they develop symptoms to get treated and to avoid exposing others. It's important for everyone in the public to know that these conversations are confidential, and when they're calling the contacts, the investigator never mentions the name of the person infected, and they also don't provide information that would lead somebody to figure out who infected them, or who exposed them. So we take confidentiality very, very seriously, even during the interviews of the contacts. Healthcare institutions who treated the exposed persons are called to discuss which healthcare providers might have been exposed and who else might have been in the waiting room or in the facility. And then we check up on the close contacts to see if they have developed symptoms. Depending on how high risk the exposure is, we might check in with them daily Or we just might check in at the end of the risk period when the person might develop symptoms and experience the disease. So those who are quarantined, so restricted to their homes so that they don't affect others, tend to be checked on much more frequently, usually daily, to make sure that they have access to food and health care. Anyone who develops symptoms is given instructions on how to seek health care safely without exposing others in the doctor's office, urgent care, or ER when they go. And then if that person tests positive, they're considered a case, and then they are called by an interviewer, and the whole process begins again. So this is traditional public health contact tracing. About a month ago, as cases rapidly increased and the stay-at-home order went into effect, we changed our investigation process to case-mediated contact tracing. And what that means is that we still interviewed every single positive case reported to public health, but we worked with the case to reach out to their contacts and provide them with all the instructions that we just described in writing. Since COVID-19 began, public health has doubled the amount of staff that we have doing investigations. We're up to about 25 now. And this includes 5 staff members that are dedicated 100% of the time to supporting long-term care facilities, which includes skilled nursing facilities, nursing homes, group homes, assisted living, all-techs, and rehabilitation facilities. There are far more than 500 of these in the county, so we have an incredible amount of staff time dedicated to just these facilities because we know those residents are at the highest risk of getting severe disease from COVID-19. We're currently working on scaling up our capacity from where we are now to 8 to 10 times that capacity, so that we can facilitate doing traditional contact investigations as soon as the testing becomes more widely available. And we know that those case numbers will continue to rise with potentially hundreds of case investigations per day. So we hope that as testing becomes more available, we can scale up, and once the governor's orders are lifted, people are going to have a lot more contacts during these investigations, and it's going to take a lot more staff to manage all of the contact tracing. And we hope to have more specific information on that plan coming very soon. Thank you.
Thank you so much, Dr. Sonnenschein. Of course, she talked a little bit about testing and how that's related to contact tracing. All these are interrelated, of course, for a big picture, but in order to do more testing, you have to have personal protective equipment for the healthcare providers in our community. To talk a little bit more about what we've done so far, what we've provided to members of our community, I'd like to invite Robert Rowley, our Director of Emergency Management, to come up here.
Good afternoon. I'm Robert Rowley, R-O-B-E-R-T-R-O-W-L-E-Y, and I'm the Director of the Maricopa County Department of Emergency Management. The Maricopa County Unified Command, which includes the combined efforts of emergency management and public health, is working to make sure there is enough personal protective equipment, or PPE, for healthcare workers and first responders on the front line of our fight against COVID-19. Maricopa County is prioritizing the distribution of our limited supplies. High priority is given to acute care hospitals and EMS transport, and an even higher priority is given to long-term care facilities with positive cases of COVID-19. Healthcare facilities throughout Maricopa County submit requests for PPE to Maricopa County. These requests are reviewed and prioritized, with priority given to those healthcare facilities with positive cases. Cities, towns, and tribal communities follow a similar process, and in some cases, municipalities may request PPE from the regional cash warehouse being operated by the Phoenix Public Safety Incident Management Team. Due to limited PPE supplies and high priority requests from facilities with positive cases, Maricopa County is not processing PPE requests from facilities without positive cases. Unfilled PPE requests are routed to the Arizona State Emergency Operations Center. To date, Maricopa County has distributed 65,000 800 N95 respirators, 149,450 surgical masks, 29,813 face shields, 82,025 surgical gowns, and 180,618 gloves. While we have distributed more than 500,000 pieces of PPE, we continue to receive requests for a limited supply, with a supply chain that has not been able to keep up with demand. The Maricopa County supply of PPE has included inventory from the Strategic National Stockpile, purchases by Maricopa County Public Health, the Arizona Department of Health Services, and also through private donations. Where to donate? If you have personal protective equipment to donate, you may drop items off at the donations warehouse at the reception area located at 1645 East Roosevelt Street in Phoenix from 9 a.m. to 1 p.m. Monday through Friday. If you have any questions about making a donation, you can call 602-506-6767. Maricopa County is putting maximum effort into acquiring PPE for all of our healthcare providers. We have ordered millions of units of PPE to stay in advance of the demand, but we, like many others, are waiting for delivery. We are also coordinating options with local manufacturing partners to obtain additional PPE. We continue to work with federal and state agencies as well as private vendors to secure protection for our healthcare workers. Thank you.
Thank you so much, Robert Rowley, our Emergency Management Director here in Maricopa County. At this point, we are going to open this up for questions for any of our news media friends who are on the line today and on the webinar. So with that, Chad, do we have anybody with their hand raised?
Yes, Jonathan Cooper has a question. Jonathan, your microphone is unmuted.
Hi, question for Dr. Sonnenschein, Jonathan Cooper at the Associated Press. When you said you're looking to staff up by 8 to 10 times the number of people doing contact investigations, when do you expect to get to that level? Is there enough funding for that? And if not, what do you need? And then how much testing, tests per day or tests per week, are necessary to get the contact tracing to adequate level to make it an effective strategy?
All right, so a couple of different questions in there. 8 to 10 times the number of people we have right now. When are we going to have those plans in place and start to ramp up those efforts? Is there funding in place? And also, how much testing do we need in order to be doing accurate or fully contact tracing? I'll let Dr. Sonnenschein field that question now, or those questions.
So because we are going to have Spanish translation, I'm just going to answer one question at a time and then allow Joanna Molina to go ahead and translate after I answer each one. So the first question, when are we going to be able to scale up to 8 times the current capacity that we have now? And the answer is that we have been working together with our intelligence team and a number of our partners, and we have a very detailed plan in place where we're going to be able to train and implement enough of a workforce to increase our capacity by 8 to 10 times. However, we're still in the process of working with partners to implement that plan, and we can't yet say when we will actually get there, but once we finalize our agreements with our partners to enhance the capacity that we have in public health alone, we'll be able to share a lot more with you.
Bueno, la pregunta fue cuánto podrán tener, qué tanto tiempo se tardará para tener una capacidad para poder hacer más pruebas, entre 8 a 10 veces más la capacidad que tenemos al momento. Y la realidad es que se está trabajando con múltiples agencias que son socios de salud pública de otras organizaciones del condado para llegar a acuerdos y poder trabajar juntos. La fecha no se tiene al momento una fecha actual, pero se está trabajando en conjunto y lo haremos lo más pronto posible.
And regarding whether we have adequate funding to expand our capacity, we are fortunate that we have received some funding through the CARES Act to facilitate this maximal contact tracing. So we are in a much better position now than we were previously.
Con respecto a los fondos, que si hay suficiente fondo para poder hacer este tipo de respuesta, la realidad es que se ha obtenido fondos de lo que se le llama el CARES Act, que al momento trae los fondos necesarios para poder trabajar y empezar a hacer los contactos de las personas que han estado con algún caso que ha sido infectado.
And the last question, how much testing do we need to be able to maximally implement contact tracing? Contact tracing is very much separate from how much testing there is. In fact, the amount of testing that is done, the more testing there is, the more people that we will identify as positive cases. So more testing means that we need to do more contact tracing. So the relationship is, as the testing increases, we need to be able to enhance our investigators and the number of people that we have doing the contact investigations to keep up with the testing. So it's more that we have to scale up our investigations as the number of testing, the numbers of testing goes up.
Otra de las preguntas fue que si el número de las personas que se hacen las pruebas va a subir también y que si va de la mano junto con el rastrear esos casos. Y la realidad es que son dos cosas diferentes, pero al mismo nivel que se hace, incrementa el número de pruebas que se hacen para las personas que están infectadas, también va a incrementar el número de casos que se tiene que dar seguimiento porque estuvieron en contacto con alguna persona infectada.
Thank you, Dr. Sonnenschein. Also, thank you, Joanna. Okay, we'll add ABC 15. You have a direct question in a second?
I do. My reporter can't watch the
Okay.
internet. He can't watch the.
Well, let's go ahead and let's answer some more questions from the webinar, and we'll take this question in a second, okay? So, Chad, do you have anybody else raising their hand in the webinar?
Yes, we have several. The first is from Ann Ryman, and your microphone is live.
Hi, what is the availability of diagnostic testing for nursing homes? We're hearing from nursing homes that even those nursing homes that have had COVID-19 outbreaks, they're having difficulty getting actually diagnostic testing.
So the question is the availability of testing, and I'm not sure that's really within our control, but Dr. Sonnenschein can speak to that. And Joanna will also join her as well.
So the availability of testing, testing is widely available throughout the county. There are a number of private and commercial laboratories that will perform testing. So there's really no limit to who can access this commercial testing. What we're finding still is that the limitation on access to testing has more to do with having the supplies to collect the specimens and the personal protective equipment to collect those specimens safely. So long-term care facilities, as well as anyone else, can access testing on any patient that they wish. However, sometimes it's difficult to secure these supplies.
Bueno, la pregunta era exactamente que si la gente tiene acceso a hacerse pruebas de COVID-19. La realidad es que existen las pruebas alrededor de todo el condado. Hay laboratorios que los están haciendo. Lo que tienen ahorita que está faltando viene siendo el equipo de protección personal. Entonces, cualquier persona se puede hacer la prueba, pero si esos laboratorios y esos lugares no tienen el equipo de protección personal, se pone en riesgo a más personas. Esa es lo que existe ahorita de controversia.
All right, Ann, thank you so much for the question. Chad, do we have somebody else?
We do. Justin Long has a question. He's self-muted. Just unmute your microphone. We can take your question. Okay, he's ready.
All right, Justin. Justin, you want to go ahead with your question? Chad, why don't we go to the next one, and we'll see if Justin can get the microphone situation figured out.
We'll move on to Peter Seymour.
Okay?
Good afternoon. My question for Dr. Sonnenschein. What has the reception been like to contact tracing during COVID-19? Have patients and contacts been suspicious during these nervous times?
All right, so Peter, with the question about the people that we're reaching out to after we get a positive case and whether they're receptive to this interaction with public health during this time. And Dr. Sonnenschein will answer that.
What I can tell you about the reception in general to public health is the nurses and investigators that we have contacting people who are infected with COVID-19 and with all of the other diseases that we investigate. They're highly trained and very skilled in having these conversations, developing rapport, and establishing trust with these individuals. And that's why we take our confidentiality of personally identifiable information and health information so seriously, because the public relies on us to keep that information confidential and not share it with anyone, even people they know and have had contact with. And because I think the public has a fundamental trust in our ability to keep that information confidential, we have been successful in working with people to get the information that we need to share with others to keep to inform them of their exposure and to keep the public safe.
La pregunta fue que sí, ¿cuál ha sido la respuesta del público, de las personas que han sido contactadas por salud pública para hacerse la investigación en caso de COVID-19? Y la respuesta es que por mucho tiempo antes de COVID-19 existía ya la confianza de la comunidad porque los investigadores de salud pública están entrenados para crear esa confianza en la comunidad y sobre todo para que exista la confidencialidad. Por eso es muy importante que salud pública no dé a conocer datos específicos de las personas o los lugares porque existe la confidencialidad entre el paciente y salud pública.
Peter, thanks so much for the question. Chad, do we have somebody else on the line?
We do. I'm going to go ahead and read Justin's question for him.
Okay.
As we have seen a rise in positive cases, how many people in Maricopa County are being interviewed on average each day for contact tracing? He has follow-up questions if there are time.
So the question, so out of all the people that have been contacted, say that again. I'm sorry, Chad.
How many people in Maricopa County are being interviewed on average each day for contact tracing?
Okay.
So to answer the question of how many are being interviewed on average each day, it would just simply be the average of cases each day because we interview every single case every day and elicit their contacts through that manner. So we know that on the weekends, testing availability drops, so those days tend to be lower, and then we start to see a rise on Wednesday when people who are getting tested on Monday, so often those numbers are well over 100 or even up to 150 people per day.
La pregunta era que si cuánta gente por promedio se hace las pruebas o se le viene haciendo el contacto de salud pública para averiguar si estuvieron contagiados o si están con un contacto de una persona con COVID-19. La respuesta es que varía, es por promedio, depende qué día de la semana se hacen las pruebas. Por ejemplo, el fin de semana sabemos que los laboratorios quizás no trabajen, entonces esos números están un poco bajos. Entre semana, empieza el lunes, la respuesta de los laboratorios regresa el miércoles y aproximadamente se ven entre 100 a 150 casos por día.
All right, thank you, Chad, for reading those questions. Glad we were able to get Justin's question in there. Do we have anybody else on the webinar? Otherwise, I'll go to ABC 15 who received an email or a text from his reporter.
We do. We have a couple of new questions and a couple of follow-ups. Let's start with Leon Gonzalez.
Okay.
Leon, your microphone is live.
Hi, thank you. My question is related with Governor Ducey order yesterday about elective surgeries allowed from May the 1st. What's your perspective, Dr. Sonnenschein, in this case? And another question, if it's possible, to remind us the resources for undocumented people in Maricopa County.
So what is our take on Governor Ducey's executive order lifting elective surgeries as of next Friday. Dr. Sonnenschein, I don't know if we really have an opinion on this, but this is certainly something the governor spoke extensively about yesterday.
The governor's executive order yesterday indicated that healthcare facilities could begin elective surgeries starting May 1st as long as certain criteria were met. And I think the most important of those criteria are that they need to be able to have sufficient personal protective equipment so that they are not relying on the state or the county to maintain their supply of PPE as they begin elective surgeries. So the remainder of the details, are continuing to be elicited, but it is important for elective surgeries to resume as long as the facilities do have sufficient personal protective equipment, because obviously they need to be able to keep their healthcare workers safe. They also have to be able to have the ability to get healthcare workers tested if they are exposed. But we do want people to continue to get the health care that they've come to expect here in the United States, and elective surgeries is really part of that.
La pregunta era acerca de cuál es la postura de la orden ejecutiva del gobernador de las cirugías electivas que se dio a conocer ya el día de ayer y cuál es la postura de salud pública del condado. La realidad es que se debe de seguir haciendo lo que viene siendo cuestión de salud, aunque sea electivo, siempre y cuando las instituciones, los hospitales o los centros de cuidado médico tengan el equipo de protección personal, tanto para sus médicos como para su personal, y no se esté esperando que el condado esté dándoles o supliendo el equipo de protección personal. Entonces, se debe de continuar haciendo las cirugías electivas porque es parte del cuidado de salud.
And the second question is what resources are available for undocumented persons? And it's important, we know that a lot of people in our community, regardless of who they are struggling right now. We know that there's been a lot of unemployment and a lot of people are struggling to make ends meet. And we have many resources available. One of them that I want to highlight is Find Help Phoenix. And that is a website where you can go and you can select what resource you're looking for, whether it's food or health care or anything in particular. You just click on the tab and it provides both free and low-cost resources to obtain whatever service or item that people are looking for.
Bueno, sabemos que existe quizás en la comunidad bien mucha preocupación en cuestión de cómo van a salir adelante, cómo van a tratar las enfermedades, cómo van a poder comer o cuántas necesidades tengan. Entonces, en cuestión de la documentación legal, queremos resaltar nosotros que tenemos un programa que se llama Encuentra Ayuda Phoenix, donde usted puede encontrar infinidad de recursos, ya sea gratis o a bajo costo, y la gente puede entrar y solicitar y ver lo que existe para la comunidad.
Thank you, Leon, for the questions there. Let's go ahead. Do you ABC 15 have their?
Yeah, first off, where will all this data be stored, and is it going to be made available to the public? What's the turnaround on that, once you compile this data?
And what data are we talking about?
From
contact tracing?
Contact tracing, yes.
Well, you're seeing that data every single day. We have, I believe it's 2,900 approximately cases in Maricopa County. We report that every single day. As Dr. Sonnenschein explained, every single one of those cases is contacted by one of our investigators, and that data is available right there. Are we going to provide the expansive numbers of contact tracing? I'm not sure that's going to be made available. We'll have to tackle that as we get to that. Do we have anything more specific on that, Dr. Sonnenschein?
I would just add that all the data and information that we collect from these interviews and from contact tracing is stored in an incredibly secure system that the county monitors and has an entire team focused on the security of that system, including so many firewalls that sometimes I can't access things myself, but it is the most secure system that I've seen, and we do take our confidentiality and our data security very seriously, and that's how we are able to have healthcare data from so many facilities and from so many sources in public health.
La forma en que se mantiene la información confidencial y segura es que tenemos un sistema tan seguro que a veces salud pública ni puede accesarlo porque tiene tanta forma de seguridad. Entonces es muy importante que nosotros continuemos con ese alto nivel de seguridad para resguardar la información médica, tanto de instalaciones que proveen cuidado médico como de la gente cuando se investigan estos casos.
So Chad, let's go back to a question from the webinar.
Okay, we have a question from Bram Resnick. Bram, your microphone is live.
Thank you, Chad, and thank you, Lisa. Question for Dr. Sonnenschein. Given how you've described the hospitalization chart in the past, apparently we're at a plateau, perhaps at a peak, and you've talked about the risk of easing social distancing and perhaps going in the wrong direction. Do you think Governor Ducey might be moving a little too quickly with what appear to be plans to open up restaurants, businesses early in May? And is the county in sync with the state, or is the state syncing up with the county when it comes to the governor's plans for reopening businesses?
All right, Bram, I think I understand the multiple questions there, but we're not here at the county to make judgment calls on what the governor is seeing. He's seeing a lot of the same data that we are seeing every single day. Dr. Sonnenschein, however, can comment on the data we've been seeing as far as the hospitalization epi curve. And yes, for the past, I believe it's about 10 days, we've been kind of bouncing up and down in a relatively plateaued way. I'll let Dr. Sonnenschein address that and then how that informs our decision. And of course, the governor is getting that same information every single day, at not only statewide, but certainly here at the local level as well, as we're all tracking this and we're sharing this and we're in sync with ADHS. Our two groups talk every single day. But I'll let Dr. Sonnenschein expand a little bit more on what we're seeing on that hospitalization epi curve and how it informs our decisions.
When we track the hospitalization epi curve, what you've seen is that the hospitalizations clearly peaked, and then they flattened, and then they started to come down a little bit. And the way we interpret that is we don't interpret a decline at all until we see something continuous for at least several weeks. And so what you'll find when you interpret all of the different methodologies that are out there for pulling back on social distancing, you'll notice that everything is gradual and stepwise, and that once you make one decision to pull back on something, you wait, and you wait at least 2 to 4 weeks, if not more, to see what impact that has before you make the next decision. And my understanding is that Governor Ducey is going to follow a similar plan to that, and we're very comfortable with pulling back slightly, watching and waiting, monitoring the data to make sure that everyone's safe, and then slowly pulling back more on social distancing as moving forward. So we're very much in support of that process.
Entonces la pregunta era que si en cuestión de las hospitalizaciones, si vemos que están subiendo o han bajado y si estamos en acuerdo con lo que el gobernador está diciendo, que posiblemente se pudiera abrir la economía o regresar un poco a la normalidad empezando ya el mes de mayo. Entonces aquí lo que estamos viendo es que se da seguimiento a todos los casos, a la gráfica de epidemiología. Vemos los números que llegan a un momento que están altos y tiene que empezar a bajar antes de empezar a relajar el distanciamiento social. Y eso se tiene que hacer por 2 a 4 semanas y lentamente, poco a poco, gradualmente, es como se va haciendo esos cambios de empezar a la normalidad.
Thank you for the questions, Bram. Chad, do we have anybody else on the webinar?
Laura Gomez has a question. Laura, your microphone is live.
Hi, thank you for this opportunity. I got kicked out of the session halfway through your statements, so if I'm asking you to repeat yourself, I apologize in advance. But could you share when county health officials are contacting people? Is this happening over the phone? Are they showing up in your house? Are they texting you, emailing you? Just if you can kind of share some of those things so people kind of know how to discern legitimate contacts from county health departments and maybe scammers. And then also, I don't know if you mentioned this, but when you talk about having 8 to 10 more people doing contact investigations, what's the current staffing level? And yeah, those two things.
Okay, I can, Laura, I can cover some of the basics for you. Dr. Sonnenschein said earlier, we currently have 25 investigators on staff who call people directly and use whatever contact information we might have to reach those people as soon as we have a positive test, and we reach out to every single person that has a positive test. So that was one thing, and I believe it's not 8 to 10 more people, it's 8 to 10 times the number of people we have right now. But I'd certainly like to, Dr. Sonnenschein, do you want to expand on anything more about that? So we reach out to every single person, 8 to 10 times more people involved in that. And Joanna, I'll have Joanna translate into Spanish as well after I give this answer. But Laura, does that answer all your questions? Sorry, you answered several, or asked several there.
Yeah, have you been doing contact testing since the very beginning of tracking COVID-19 tests?
Yeah, so Dr. Sonnenschein went into quite a bit of detail on that, on the level of contact tracing that's been going on in the community early on, whenever it wasn't a whole lot of people that were involved in this, or a whole lot of cases, I should say. They were, our investigators were contacting not only the positive cases, but were contacting every single potential contact of that person. And as she explained earlier, that's healthcare workers, family members that are most at risk. And then also after that, and then since then we went to asking the positive cases to help us expand that reach a little bit by contacting their own contacts. Right now, what we will want to do to have a more complete surveillance of the disease in our community is we staff up, we put this plan in place, and we will have more people, so we go back to directly contacting every person who is a potential contact. So I don't want to say true contact tracing, but more thorough contact tracing.
Entonces la pregunta era que si se han estado haciendo ese tipo de contacto, seguimiento con las personas que pudieran haber estado expuestas a algún caso de COVID-19. Y la realidad es que Salud Pública siempre ha trabajado con investigadores. Ese tipo de procedimiento siempre ha sido usual, donde hay un contacto con una enfermedad contagiosa, se investiga completamente, se le deja saber a la persona y se hace un historial precisamente para evitar que se siga propagando la enfermedad. Entonces al momento existen 25 investigadores en el condado de Maricopa, se empiezan a implementar otros más para poder tener más alcance en la comunidad, y al momento se está utilizando la forma en que las personas que resultan positivas tienen que también contactar a las personas con las que ellos estuvieron en contacto y dejarles saber de la posibilidad de que pudieron haber estado infectados. Lo mismo hace Salud Pública con esas instituciones de salud que trataron a esta persona infectada.
Laura, thank you for the questions. Do we have anybody else on the line, Chad?
Yes, Bob Christie has a question. Bob, your microphone is live.
Thank you. Bob Christie with the AP for Dr. Sonnenschein. So we see that hospitalizations have trended slightly down and are leveled off, and not only in Maricopa County but statewide, but we've seen a big rise in deaths this week. We had 3 consecutive days with record deaths. We've been running averaging 10 a day. Now we're 21, 21, and 20 in 3 consecutive days. So can you talk to us about what we should be interpreting this rise in deaths as, whether it's a lagging indicator, whether this is your nursing home population that you've seen a rise in deaths in, and help us understand whether we should expect this level of daily death reports moving forward. How should we interpret those numbers?
Okay, question about the numbers and the death reports and stuff. Dr. Sonnenschein will answer that.
Yes, that is an important question, and we are following our deaths very, very closely. We do expect that the number of deaths is going to lag behind the number of hospitalizations and the number of cases. So we always know that when we see a rise in cases, about 2 weeks later, we're going to see a rise in hospitalizations, and then several weeks after that, we tend to see a rise in the deaths. And that's because once people are hospitalized, a death, if it's going to occur, often takes several weeks, and then it needs to get reported to public health. So we were anticipating an unfortunate rise in the deaths when we saw the rise in hospitalizations before, and we hope that as the hospitalizations leveled off, we expect to see the deaths leveled off. And as you astutely mentioned, we definitely expect that the majority of deaths to be in individuals who are 65 and older and who have chronic medical conditions. And tragically, a lot of those individuals are residents of long-term care facilities and other skilled nursing facilities. So that is the reason why we have gone out of our way from the very beginning to reach out to all long-term care facilities in the broadest sense. So that includes assisted living. And we contact them weekly. We ask them how many people have respiratory symptoms in their facility, how many people have been hospitalized, how much personal protective equipment they have. And as soon as we see an increase in any type of respiratory illness, we work with them to get those individuals tested right away. And if there's a case in the facility, or if there's a healthcare worker working in the facility that's positive, we have an incredibly strict set of infection control recommendations that we walk through with the leadership of the facility. We make sure that every resident is put on isolation precautions, confined to their room, has meals alone in their room, and actually even covers their mouth and nose when a healthcare worker walks in. And the healthcare workers have to wear a mask the entire time while they're in the facility and wear gown, gloves, mask, and eye shield every time they interact with a resident. So we know that sounds like a lot, but that is what it takes to keep COVID-19 from spreading once it gets in a facility. And what we found is that the vast majority of facilities who implement these precautions are able to keep it to 1 or 2 cases. But there are some situations where we've seen a lot of spread, and tragically that is why we're seeing this increase in deaths.
La pregunta era que si el alto índice de muertes en las personas, ¿cómo se debe de interpretar? La respuesta es que se esperaba que subiera el número o el índice de muertes. Una vez que vemos el número de casos de hospitalizaciones que ha subido, por ende, puede ser que pueda resultar algunas muertes y eso tarda en reportarse. Entonces, una vez que suben las hospitalizaciones, va a subir el número de muertes en las próximas semanas. De la misma manera, una vez que empiecen a bajar, puede ser que esté disminuyendo también el número de hospitalizaciones. Con referencia a cómo se trata eso con las personas de la tercera edad o los grupos de alto riesgo, una vez que se detecta quizás algún caso específicamente en los grupos de alto riesgo, como viene siendo los centros de cuidado médico de largo plazo, lo que se trabaja muy de cerca con ellos para ayudarlos que estrictamente tengan la forma, el material adecuado de protección personal, ya sea que usen guantes, que usen la mascarilla, que utilicen toda la cobertura de la cara, las batas médicas una vez que interactúan con alguna persona que ha estado infectada y poner a esa persona en aislamiento en su cuarto donde pueda desde comer y hacer todas sus actividades. Todo el personal tiene que usar el equipo de protección personal y hemos visto que se ha podido controlar cuando se detecta a una forma temprana.
So we have time for probably 2 more questions this afternoon. So Chad, do we have anybody else on the webinar?
We do. Justin has a follow-up, which I will read for him.
Okay.
Justin asks, what specific piece of PPE is most needed right now, and how much of the PPE resources are being directed to long-term care facilities? Can the department keep up with the demand?
Okay, so the question is about PPE. What are we short of most, and where has most of it been, or at least the last few bits of supply have been appropriated? So Robert Rowley can answer that question today about PPE.
So depending on how much PPE we have left to distribute really depends on which one we're talking about. The most critical one at the moment are surgical gowns, We are down to just a few days' supply on that. We've been managing to get great cooperation from our city partners that are sharing some of the supply that they have to make sure that our most critical facilities, the long-term care facilities, continue to have them. But that certainly is our biggest concern at this point. The next is a tie between N95 masks and face shields, which we're down to 2 to 3 weeks on each of those. And then the remainder, we still have 4 or 5 weeks on that supply.
Entonces la pregunta era que si, qué es lo que se necesita más del equipo de protección personal, y mencionaba que lo que se necesita más en este momento viene siendo las batas médicas quirúrgicas, especialmente para los centros de cuidado médico de largo plazo, y también se necesitan lo que viene siendo las mascarillas N45, 65, que vienen a proveer protección a la comunidad, que tienen solamente varias semanas, ya quedan solamente para poder tener ese tipo de mascarillas. También viene siendo otras cosas que duran 3 o 4 semanas más, pero lo que se necesita viene siendo las mascarillas y las batas quirúrgicas, que solamente se tienen como para 2 semanas.
All right, thank you for the question. Chad, do we have anybody else who hasn't gotten a chance to ask a question on the webinar today?
We have one person who has not had a chance.
Okay, let's go ahead with their question.
Take, Tom Scanlon.
Okay.
Tom, your microphone is live.
Thank you. When will you provide the names of long-term facilities that have had positive COVID-19 tests? And when will you update the daily hospitalization data so it is a daily census rather than cumulative?
So I will let Dr. Sonnenschein will field both those questions.
Providing specific names and data associated with long-term care facilities is something that can be used to identify individuals who live in those facilities. And furthermore, it is very important that we continue to maintain a relationship of trust when we work with these long-term care facilities, so that they will continue to work with public health and implement all of the infection control recommendations that we have. We strongly encourage long-term care facilities to communicate with the residents and the families that live there and share all of the information about what infection control precautions are being implemented, whether there are cases in the facility. And as you're aware, that is going to be a CMS requirement, the details of which are going to be released. So as long as the residents and families are being made aware of the cases in there, and we consider that information confidential, we have no intention of releasing those data.
La pregunta era cuándo vamos a dar a conocer los nombres de los centros de cuidado médico de largo plazo. Debido a que es la confidencialidad de los pacientes y del personal, no se dará a conocer esa información. Sin embargo, se trabaja muy de cerca con ese tipo de centros de cuidado de largo plazo, médico de largo plazo, para que ellos estén informados, educados y puedan hablar con las familias y los residentes y decirles la situación de lo que está pasando, y ellos sean los que comuniquen. Nosotros no daremos a conocer esa información.
Okay. Thank you very much, all of you, for being with us today for the webinar, for this this live press conference here on Facebook and YouTube as well, via the Maricopa County pages. If you're a member of the media, you have further questions, you want to pass them along to us, caomedia@maricopa.gov. We always do our best to get to everybody every single day and get their answers to them as fast as we can. So thank you so much for being a part of this webinar today, and thank you to our friends in the media for all the good questions. We certainly want to keep you informed as best we can during these difficult times and during this pandemic. So we'll let you know about our next update next week. Thank you again.